You have been invited for an ultrasound scan of your abdomen to help in the diagnosis of your condition, and this video will help you to prepare and to know what to expect. Ultrasound uses high-frequency sound waves to obtain pictures of the inside of your body. It's popular because it doesn't expose you to any radiation. It is very quick and is non-invasive. It has been used without any side effects for over 30 years. There are some important things you need to address before you come for your scan. Your appointment letter will tell you where your scan will take place, and it's best to arrive in plenty of time. You may want to ask a partner, a friend, or a relative to be with you. It's up to you whether you bring one companion into the examination room with you. We suggest that you do not bring any young children as there are no facilities available to look after them. Please let us know before your appointment if you have any mobility problems for which you may require assistance. Even if you think your symptoms have resolved since the appointment was made, please still come along, as this will help you to better manage your condition in the future, and we may even see something that explains why you had the symptoms in the first place. However, if you decide not to attend, please let the department know in plenty of time so that your appointment can be offered to somebody else. For this scan, you will need to expose your entire abdomen, so make sure you wear loose-fitting clothes. Depending on whether we are scanning your abdomen, pelvis, or your kidneys and bladder, your invite letter will advise you whether you have to starve before the scan. If you have to starve, you can still drink clear fluids, but not milk. Diabetics can have one piece of toast, but should not have butter. For some scans, you will be asked in your appointment letter to have a full bladder. If needed, please drink 1 or 2 pints of water an hour or two before your scan, and please avoid emptying your bladder until after your examination. If you cannot wait any longer, let one of the assistants in the department know. Please do not worry if you cannot manage a full bladder, as we can scan you anyway. If you're on water tablets, you can take these as normal. We don't ask children to do anything special, so they can eat and drink as normal. When you are called into the examination room, you will be met by one of our specialist medical team, and occasionally an assistant. The room is quite dark so that it is easier to see the images of your body on the screen. Please ask if you have any questions or concerns about the examination. You will be asked to lie flat on the couch. Clear gel will be put onto your abdomen. We will then use a probe to take pictures. The probe will be moved over your skin and images will appear on a screen. You may experience some pushing as the probe is positioned so that your internal organs can be seen more clearly. This should not be painful, but may be a little uncomfortable. You will be asked to change position and breathe deeply to help us to get the images that we need. Sometimes it is necessary to scan the organs in your pelvis. For this, we will examine further down your abdomen and will ask you to shuffle your waistband down to just over your hips. The scan will take up to 20 minutes. Once it is complete, you will be given some tissue to wipe the gel off your abdomen, and then you can get dressed and go to the toilet if needed. We will not be able to give you a diagnosis at this point, but will pass all of the information on to the requesting doctor, either your GP or a hospital doctor, who will ask you to attend an appointment with them to discuss the results.